everybody, it's Dr. Joe, and today I'm going to show you my top 7 treatments for knee pain. So let's get started. Disclaimer alert, disclaimer alert. So as you can see, I'm wearing a knee support sleeve, but I'm going to talk about that a little bit later. So I'm going to go ahead and take this off and start with some of the treatments. So the first thing is going to be patella moves or kneecap moves. And the reason why this is an important treatment is because the kneecap is attached to the quad tendon and the patellar tendon and then the quad muscle up top. And so when these are really tight, it puts a lot of pressure and tension on that kneecap, pushing it down into the joint. So the more you can have your kneecap moving around, the less pressure and pain in your knee. So this is one of the things where some people really hate this movement. It kind of freaks them out a little bit. So you can do it yourself, but you need to be completely relaxed. So if you need somebody else to do it for you, that's fine. So just kind of take your fingers, find your kneecap, and sometimes it's in a different spot than where mine is, depending on just your makeup of your body. But put your fingers on each side, and then you're just going to push side to side. So you can see that my kneecap is moving pretty well because I don't really have any knee issues. But if you're having a lot of pain or if you have an injury in there, it might not move very much. But what you want to do is make sure you're not pushing down while you're going to side. You're just really going side to side, because if you're pushing down, you're just grinding that kneecap into that joint. And you can push pretty hard unless you have a specific injury like a kneecap dislocation. That would be something where you wouldn't want to continue to push on it. But if you have just general knee pain, you can push pretty hard to get this thing moving. So just go side to side for a little bit, and then you can take your thumbs and fingers and then go up and down. But same thing, I'm doing this motion. I'm not scooping it because that's going to push that kneecap down into that joint. So again, up and down, side to side, you can kind of switch back and forth and just do this for a couple minutes. The first time you do it, you might want to just do it for 30 seconds. But if it's painful, you don't want to do it. But if it's uncomfortable, go ahead and see if you can get it moving, because a lot of times then you start moving it and then it starts going really mobile, and that's good. That's what you want. You want that kneecap to kind of be floating on top there and not right in that groove of the femur bone there. So once you get that all kind of loosened up and stretched out, then you can go into some isometric type of exercises. So the next thing we're going to go into is a quad set. Quad sets are really nice because if you have a lot of knee pain, this is kind of the first step to exercising, where you're not making big movements that might be painful, but you're starting to activate those muscles again. And this quad muscle is really important in our knee movement and our kneecap movement, so you really want to get it going. And a lot of times if you have a pain or injury in your knee, the quads kind of just don't fire anymore. I like to use a little target underneath my knee. You can use a little foam roll like this. This is just a pool noodle, but you can also just roll up a towel. You can do it with your knee completely straight, but I feel like when you have a target, it works a little bit better. You don't want it to be really high because you want your knee to be close to straight, but it doesn't have to be straight. And so all you're going to do is you're going to contract or tighten up that quad muscle to try and push that knee down into the roll. The key is not to lift your heel. If you're going up like this, that's a different exercise, and that's actively moving it. So you want to just squeeze it down, and you can see here where my muscle is activating. You want to activate that muscle. You want to try and squish whatever is underneath. Hold it for about 3 to 5 seconds, and then relax. So again, if you have an injury or if you have some pain, you might be squeezing and you might just get a little tremble in that quad. You might not get a full contraction like that, and that's okay. This is what we're working up to, but eventually you want to be able to see that muscle contracting. So again, holding it for 3 to 5 seconds, maybe do 10 reps. It really depends on what your injury is, how far out you are from your injury. So I can't give you exact numbers. I would just say in general, start with 10, 1 to 2 sets of 10 a couple times a day, and then you can kind of progress your way up from there. So then the next one is a hamstring set. And so that's another isometric movement. So with the hamstring set, this time you're trying to activate the hamstring muscles underneath, because those cross the whole joint as well. So the quad kind of crosses it by being connected to the patella, but the hamstrings actually cross the whole knee joint. So you want to get those activated too. You want to get those moving again, and doing it isometrically is a great way to kind of relax it. So all you're going to do is bend it up. And so what I'm doing now is I'm pushing that heel down into the floor. And so you should be able to see my hamstrings right there activating a little bit. So it's the same thing. You're just pushing down as far as you comfortably can, holding it for about 3 to 5 seconds, and then relaxing. So you're pushing just to right before pain. If it's a lot of pain while you're pushing, push a little bit less, or maybe you're not quite ready for that again. And so same thing, just start off with maybe about 10, you can progress from there. So then the next thing is using a knee support sleeve. And the folks at Sleeve Star sent me their knee support sleeve. And so this one is really cool. There's several reasons why I like this sleeve. And one of them in particular is it's made with a very breathable material. A lot of knee sleeves are made with neoprene. And neoprene, just if you've ever worn a sleeve like that, it doesn't whisk away when you like sweat on your knee, and then so it gets kind of really hot in there. And this is just very breathable. It's anti-odor, so then when you're using it, it just kind of whisks away the sweat and some of your stinkiness. And so it's really nice in that fact because it's very breathable. And that's really important to me because a lot of times I have a little bit of skin sensitivity, and this type of material always seems to work better for my skin. But it also has, I'm going to flip it over and you can see where it has here to hold it in place. So it's anti-slip. So it's got that silicone gel to hold it in place. And here it's a little bit tighter. So you can see here that it holds it better down here. So this prevents it from sliding down your leg, which is also really nice. Knee supports in general, to me, are great. They're not going to stabilize. It's not a brace. It's not going to protect your knee from, going one side or the other. But what it does is it has that compression. And what compression does is it's a great thing because I call it a hug. It's almost like a hug when you feel, you give somebody a big bear hug and it just feels really good. It helps increase that circulation to the area, and that's really important in a lot of different ways. One, it helps prevent the swelling. So if your knee swells up a little bit, you have this compression, it pushes that swelling out of there, and then it helps keep whatever injury in there, not having all that swelling and irritation that causes continued pain. The compression also helps keep the area warm. So again, that warmth, if you're exercising, it helps loosen up those muscles around the knee joint. So it's really nice to kind of have that warmth in there too. And it does give support. It's not a stability or an instability stopper, but it does give a support where it just kind of holds everything together. So again, if your kneecap is a little bit painful because maybe it's pushing on that tendon or something, this kind of supports it in place just to take some of that pressure off of it. So I really do like the knee sleeves. I especially like this one just because it has some extra benefits to it. But what I do like about it is you can wear it while you're exercising and stretching and things like this. This is something that sometimes if you're in that acute phase where you just have your injury, you can wear it all day. But I personally wouldn't long-term wear it all day. Wear it when you need the protection, if you know you're going to be doing, maybe going out for a jog or doing some intense exercises, but just for everyday use, it's probably not something you want to do. If you're in a therapy session or rehab session, sometimes you want to take it off as well because you really want those muscles to do the work. But in general, this is really just a support, and I really like it, and you can see that it just kind of stays in place. I can, bend it and move it, and it's not sliding around, but it's not cutting off my circulation either. And so it feels really, really good. If I went off and did something, I probably wouldn't even notice that it was there because it's not constricting. It's just enough for that nice little hug. So for the rest of the stretches, we're just going to move on into a hamstring stretch. So like I said, you definitely can wear this while you're exercising, and the great part about it is it's not just going to slip down and fall off your leg. So going into a hamstring / calf stretch, you can do a combination with this stretch just to save time if you need it. If you're doing a calf stretch as well, try and bring the strap a little bit up to the ball of your foot. If you don't have a strap like this, you can use a dog leash, you can use a belt, but something that you can make a loop with usually works best. So you're just going to kind of lie down so you can just relax, and you're going to use the strap to bring up your leg into a stretch. And so it's going to stretch your hamstrings, and if you pull your foot, that's going to stretch out your calves as well. So that's what ends up getting the double stretch. So see how I'm kind of pulling down, and so I'm getting the stretch in my calf here, And as I come up higher, I'm getting the hamstring stretch there as well. So you might only be able to come to here, that's fine. You know, the higher you go, the better, but if your knee starts bending, then you're not getting a stretch anymore. So if your knee starts bending and you're here, try and bring it back down until you can get that stretch, because otherwise you're not stretching those hamstrings if you're bending your knee. So holding there for about 30 seconds, come on back down, and then you can do that 3 times. I like to leave my knee up over here for this one just because it takes some pressure off of the back, but you don't have to. Some people like to leave it down, and that's fine as well, because the next one that we're going into is an IT band stretch. And so for this one, you probably want to bring that leg down just a little bit or all the way down, because you're going to kind of come back up into that hamstring stretch, keeping that leg straight, and then you're going to bring it across your body. And you should feel it anywhere from your knee up to your hip, because that IT band or the TFL starts up here at your hip and then comes down and it passes your knee also. So it's really just as important to have that one stretched out as well. And a lot of times we forget about that IT band, but it can cause a lot of problems if it's really tight. So again, try not to just bring your whole body over, but just that leg over, so you're getting that nice stretch in there. And again, 30 seconds, doing 3 on each side. And so the last one is going to be a quad stretch. And so again, the quad is really important, because if it's tight, it's putting pressure on that kneecap and then it's pushing it down in that joint, causing a lot of pain. So you can do this in side lying, or you can do it on your tummy. Sometimes I like it better on my stomach, because then it kind of supports my thigh, because you want that thigh to be straight. But you can also do it on your side. I'm going to do it on my side right now just to kind of show you, but I'm going to do my top leg just so I can look at you while I'm doing it. But normally if it was this leg, I'd want it to be on top. When you're doing it on the side, you want to make sure this part is straight down. If I'm up like this and I'm stretching my leg like this and I'm bringing it up, I'm not really stretching my quad. So I want to even bring it back maybe just a little bit, and then try and pull that knee towards my bottom. Now I'm propped up. I wouldn't prop up, I'm just kind of talking to you, but I would lay down and then just pull like that. So you can see that my hip's straight. But for people who are tight, again, if you're okay rolling over onto your stomach, you might want to do it that way, because then you don't have to worry about focusing on your hip, because it's down on the floor and there's no problem. You can also do all these stretches and exercises in your bed. If you have a hard time getting on the floor, you don't have to do it on the floor. You can do it on bed. You can do it on a couch. It might be a little bit more squishy, but that's fine. I don't want you to get on the floor and then not be able to get back up off the floor. So again, holding this for 30 seconds, doing that 3 times. And so if you're having knee pain on both sides, do it on both sides. If not, that's okay too. So there you have it. Those were my top 7 treatments for knee pain. If you're interested in purchasing the Sleeve Stars knee support sleeve, make sure and click on the link up there. And don't forget to subscribe by clicking down there. And remember, be safe, have fun, and I hope you feel better soon.